Pharmacology and the role of pharmacists. Pharmacology is the branch of medicine that focuses on the study of drugs, their effect on the human body, and how they are absorbed, metabolized, and excreted. This discipline is essential for the development of new drugs and understanding how existing medication works. Pharmacists play a critical role in ensuring that medications are prescribed and administered properly to achieve the desired therapeutic effect while minimizing adverse effects. One key area in pharmacology is pharmacokinetic, which is look at how the body absorbs, distributes, metabolizes, and eliminates drugs. Another important aspect is pharmacodynamic, which is the study of the effect drugs have on the body, including their mechanism of action and therapeutic use. For example, antibiotics are used to treat bacterial infection, while analgesics are prescribed for pain relief. Pharmacists must also be aware of drug interaction, where one drug may affect the effectiveness or side effect of another. In addition, contraindications are conditions or factors that make the use of certain drugs dangerous or inappropriate. It is crucial for pharmacists to monitor and educate patients about the proper use of medication to ensure optimal therapeutic outcome. Read the text quickly to identify the main idea. Based on your skimming, answer the following question. A. What is the primary focus of pharmacology? The primary focus of pharmacology is the study of drugs, including their effect on the human body and how they are absorbed, metabolized, and excreted. B. Name two areas of pharmacology mentioned in the text and explain their relevance. Pharmacokinetic studies how drugs are absorbed, distributed, metabolized, and eliminated by the body, which is important for determining correct dosage and timing. Pharmacodynamic studies how drugs affect the body, including their mechanism of action and therapeutic effect, helping to understand how drugs work. Scan the text carefully to find specific information and answer the following question. What is the term used to describe the study of how body absorbs, metabolizes, and eliminates drugs? The term is pharmacokinetic. B. Identify one example of a drug mentioned in the text and describe its use. Antibiotic. They are used to treat bacterial infection. Number 2. The development of generic drugs has become a significant aspect of the modern pharmaceutical industry. Generic drugs are copies of brand name drugs that are produced once the original patent expires. They are required to have the same active ingredient, dosage form, and strength as the brand name drugs. Generic drugs offer a more affordable alternative for patient and healthcare system, particularly in countries with limited resources. The approval process for generic drugs is rigorous, ensuring that they meet the same standard of safety, effectiveness, and quality as the brand name drugs. This process involves clinical trials and bioequivalence studies to demonstrate that the generic drugs perform in the same way as the original drugs. Despite this, the affordability of generic drugs can be limited by factors such as manufacturing costs and market competition. One major issue with generic drugs is that they may not be as widely available as the brand name drugs, particularly in less developed countries. Pharmaceutical companies often prioritize manufacturing brand name drugs, leaving generic alternatives in limited supply. Additionally, some patients and healthcare providers may be reluctant to switch to generic drugs, fearing that the quality may not match the original. However, regulatory bodies such as the U.S. Food and Drug Administration and the Europe Medicine Agency have strict regulation in place to ensure that generics are safe and effective. In the context of modern healthcare, the role of pharmacists becomes increasingly important in educating patients about the benefit and safety of generic drugs. Pharmacists must also work with healthcare providers to address concerns regarding the use of generic and ensure that patients are receiving appropriate medication. The increasing reliance on generic drugs in the global healthcare system presents both challenges and opportunities for pharmacists, as they play a central role in the dispensation and education surrounding this medication. Question. Based on the phases, discuss the benefits and challenges associated with the use of generic drugs in modern healthcare. How do pharmacists contribute to the success of generic drug use? And what role do they play in addressing patient concern? Use specific examples from the passage to support your answer. Based on the passage, generic drugs offer important benefits but also present several challenges in modern healthcare. One major benefit of generic drug is their affordability. The passage explains that generic are produced after the original patent expires and required to have the same active ingredient, dosage form, and strength as brand name drugs. This makes them a more affordable alternative for patient and healthcare system, especially in countries with limited resources. Despite these benefits, the passage highlights several challenges. One challenge is limited availability, particularly in less developed countries, because pharmaceutical companies often prioritize manufacturing brand name drugs. Another issue is patient and healthcare provider reluctance to use generic due to concern that their quality may not match the original drugs. Pharmacists play a crucial role in the success of generic drug use. According to the passage, pharmacists are responsible for educating patients about the benefit and safety of generic drugs. They also work closely with healthcare providers to address concerns and promote confidence in generic medication. Number 3. A patient comes to the pharmacy to pick up a newly prescribed medication for hypertension. Upon receiving the prescription, the patient expresses confusion about the correct dosage and potential side effects of the medication. The patient also asks if there are any cheaper alternatives to the prescribed medication. As a pharmacist, you need to provide clear information and suggest a appropriate solution. Question 1. How would you manage the conversation with the patient regarding the medication use, potential side effects, and alternative drugs? I will listen carefully and reassure the patient to create a comfortable and trusting environment. I will then compare the medication, name, dosage, and frequency as written on the prescription and assess the patient understanding. I will ask relevant questions to ensure the information provided is appropriate. I will explain the dosage clearly and address the patient concern about side effects and costs in a calm, professional manner. Number 2. How would you educating the patient on the proper use of the medication and explain the potential side effect in a way that is easy to understand? I will explain the medication using simple and non-technical language. For example, by describing when and how often the medicine should be taken. for side effects, I will focus on the most common and important ones. Explain what the patient might feel and clarify which side effects are mild and which require medical attention. Number three, Number 3, what step would you take if the patient asks for a cheaper alternative to prescribed medication, and how do you ensure that the alternative remains safe and effective? If the patient asks for a cheaper alternative, I will check whether a generic version of the medication is available or if there are another therapeutically equivalent drugs within the same class. I will explain that generic drugs have the same active ingredient, strength, and effectiveness as brand name drugs, but are more affordable. Before recommending an alternative, I will ensure there are no contraindication or drug interaction and communicate with the prescribed doctor. And communicate with the prescribing doctor.